Hello everyone, good afternoon everybody. I am Sanya from Beautiful Spotless Skin Team and I'm sure all of you must be keeping good health. To look beautiful and smart at all times is quest of humans right from the beginning of civilization. Few of the common conditions affecting the look and feel of a person is acne, hyper or hypopigmentation and even hair loss. Out of these, acne is a big concern, especially for women in their 20s. However, it would be wrong to say that men don't suffer from acne. To many, acne is known as blemishes, blackheads, whiteheads, pimples, or cysts. It is most common during puberty and adolescence. According to recent data, almost 80% of people in the age group of 11 to 30 years have acne breakouts at least once. Although acne most commonly does not have any serious health concern, but it is distressing for the sufferer. The faster issue is diagnosed, more effective will be its treatment. Thus, knowing about acne management from an expert is essential. For this today, we have with us Dr. UK Pallavi from Patna, live with us to educate us more on acne awareness. Dr. UK Pallavi is a renowned dermatologist based at Patna. She is an assistant professor at Department of Skin and BD at IGIMS Patna. With her expertise into dermatology, she is here to address the most specific concern of the skin, that is acne. Doctor, most welcome to our live session.
Hello.
And it's a pleasure to have you here as today. And as we're going to discuss about a very important topic, that is acne awareness, how to manage acne. So my first question is, when we talk about acne, so what is basically acne? How we can define acne? And if we talk about the causes as well. So what are the causes of acne, doctor?
Hi, friends. Today we'll discuss about the acne. Acne is basically a chronic inflammatory disease of pilosebaceous unit, which manifests mostly in the adolescent age group. And it's present as a polymorphic lesion, maybe in comedones, like people we say blackheads or whiteheads, papules, pustules, cyst. It manifests as a that. But maybe people don't understand what is a pilosebaceous unit because it is a scientific term. For general people, I can explain it. Okay, with the hair follicle, there is a gland, sebaceous gland, which secrete more in the age of the adolescent age group because of the hormonal changes. So that sebum gets deposited in the skin and it gets more problem, and may people have this acne lesions, or we can call pimples.
Okay, so basically we can, in simple term, we can define as, when people have pimple, we can call it that is having acne, right, doctor?
Yeah.
Okay, and doctor, when we talk about the causes, why, sometimes people are so, worried that why acne is coming to me or why pimples are, coming on my face, and sometimes people also have on their back as well. So if we discuss about the causes, if we want to know about the causes, so acne के major causes क्या होते हैं, किस वजह से acne होता है?
Mainly the first most common cause is adolescent age, that is the teenage group. Okay? Because at that time people they have many hormonal changes, like in male they have hair develop, mustache and beard or puberty hair. So with that the glands also develop and that secrete more sebum, and that leads to deposition as a keratin plug on the skin, and they develop the acne on the face. So it is mainly because of the hormonal changes. The next maybe the cause of the environmental also, maybe family history of acne, also patient having family history in that patient may more chances of having acne if they are having family history positive. And maybe of food diet also, because of this cosmetic use of without concerning. Nowadays people are using cosmetics of their own choice, seeing in electronic media, or they're searching, okay, which is more, which gives you more glow or fairness cream. They may also develop that.
Okay, so these are the various causes, as you said. People generally don't consult a dermatologist. They
Yeah.
just see, something on the internet, and they apply on it, and then also that can also be a cause of acne. And as you say, family history can also be a cause of acne. Doctor, when we are talking about acne, are there any grades of acne? Like, okay, this is the first grade, or acne, like, are there any grades of acne?
Yeah, acne divided into grade 4. Where it's very much for us. It is important dividing into grades. It's important for the dermatologist because it depends on the treatment plan also. Like in grade 1, 2, 3, 4. In 1, we have comedones. We can say blackheads or whiteheads. In 2, we have comedones or few papules. In grade 3, we have papules, pustules also, and few cysts. In grade 4, we have all mixed type of lesion, and more goes in favor of nodules or cyst, which is painful sometimes.
Okay, so there are 4 grades of acne, and as doctor said, the fourth grade is the most painful. Sometimes
Yeah.
we also have a pimple which cause pain, and usually people pop it up. Usually people do it that they pop it up the pimple that ye chala jayega. So is it right, doctor, to pop that pimple up? And if somebody is having a pimple, or no blood is coming out, so usually they just pop it up, and स्किन भी पूरा निकल जाता है. इज इट राइट टू डू दैट? क्या वो सही है?
No,
ऐसा हमें करना चाहिए?
no. We always advise don't squeeze it or don't do it manually. Go to the dermatologist. We have some instrument which can remove your keratin, deposited keratin plugs. We can say that comedones or whitehead, where we remove it. And if you have this more pustular lesion or cystic or nodular lesion, then sometimes we need to give intralesional injections to that to absorb or dissolve it. Or sometimes there is a pus collection in the cyst, we have to aspirate it also.
Right. So a dermatologist better
advise,
know.
yeah,
Yes,
I
yes,
always
yes.
advise don't do it your own, otherwise it leads you more scarring or pigmentation to the patient.
Okay, so pigmentation or scars can come if somebody pop it up pimple. Okay, so that can be another issue. That if someone is having scars or pigmentation on their face, right, right. So don't pop your pimples up. Go and consult your dermatologist if you are feeling, not feeling that comfortable. And doctor, when we are talking about acne, we are talking about acne grades. We are talking about what are the causes. But when we talk about the treatments, so why it is necessary that as early as possible, acne, you see acne, you should probably go to a doctor and take early treatment. Why early treatment of acne is basically important?
Early treatment is not only in acne, in any disease, I can say give you better chances to heal, less duration, less cost effective. And in acne, if you treat early, give you less pigmentation, less scarring, and sometimes this acne also leads to patient a psychological stress also patient may have. So early treatment can prevent you from that also.
Right. So as
And
soon as
cosmetic disfigurement of the face, it prevents you from the cosmetic disfigurement of the face.
Right, right. So as soon as you see that your acne is increasing, or you are having more chances of 1 month may you have seen a lot of acne on your face, do consult your dermatologist, because as doctor said, that as early as you go for the treatment, it's better for you. Doctor, when we are talking about acne, sometimes some people have acne, some people don't have acne. So when we talk about a particular skin type, so is it like that, that a particular skin is acne prone skin, or this particular skin type is acne prone skin type?
As I said, family history is also important in acne patient. Is mother or father having acne, so their most chances is more is their kids. And the other is the patients. If a patient have more oily skin, they develop more acne, chances of developing acne. And the other is the if patient is having blackheads and whiteheads in early ages, so they can predict, okay, I in future I can go through the other stages of acne, like grade 4 and grade 4. So it's better you feel you have this comedones like blackheads and whiteheads, so you start treating it early, so it can prevent you from getting into grade 4 or grade 3.
Okay, and as such, prevention is always better than the cure. So as soon as you see that you are having blackheads or whiteheads, as doctor said, you must go and be aware that acne is going to occur. Doctor, when we talk about acne, there are sometimes breakouts also, and people stress out, and sometimes acne also occur due to stress. That if some important event is coming up, people are worried that acne ये pimple मेरे चेहरे पर ना आ जाए, but at that point of time pimple always come. So is stress can be a cause of acne, and how somebody can prevent the acne breakouts which usually occur in people?
या ब्रेकआउट स्ट्रेस से भी होंगे, मेंस्ट्रुअल अगर हिस्ट्री है साइकिल पास आ रहा है तो भी एक्ने आने लग जाते हैं, और हम लोग को काफी स्ट्रेस हो जाता है कि ओके मेरा पार्टी फंक्शन है, अभी ये प्रोग्राम है और मेरे को भी एक्ने आ रहे हैं। तो उसके लिए अगर पहले से ही ट्रीटमेंट ले रहे हैं अगर एक्ने का, तो उस ड्यूरेशन है कि स्टॉप नहीं करना है, और कुछ और भी आप प्रिकॉशंस ले सकते हैं, जैसे कि मैंने पहले भी कहा कि स्क्वीज नहीं करना है। स्ट्रेस रिलीज तो ये आप खुद से ही आपका है कि स्ट्रेस रिलीज आप अपने आप को कैसे करें, या यू हैव टू कंसल्ट योर psychiatrist. You can consult your psychiatrist or your dermatologist also for releasing your stress. और हम कोई भी कॉस्मेटिक जैसे यूज करते हैं तो वो हमारा नॉन कॉमेडोजेनिक होना चाहिए, ऑयल फ्री होना चाहिए, जेल बेस में या एक्वस बेस में होना चाहिए।
Okay, so that's how we can prevent the acne breakouts. And it's like that, doctor, that acne have specific season. That summer season may it will more, or in monsoon season it will more, and in winter it will be less. Is it like that?
या मॉनसून सीजन में हॉट एंड ह्यूमिड क्लाइमेट की वजह से ये थोड़ा इंक्रीज होने लग जाता है, क्योंकि इस टाइम जो माइक्रो ऑर्गेनिज्म है उसको ज्यादा इन्वायरमेंट मिलता है फ्लेयर अप करने के लिए। तो ये ब्रेक थ्रू हम लोग को देखा गया है कि इस मौसम में ज्यादा इंक्रीज कर जाता है एक्ने।
Okay, and as we are already into the monsoon season, so take care. Doctor, what are the prevention somebody can take in this particular season?
For that we can use toner to clean your face. We can keep your face dry, and hair, clean your hair also regularly, and keep your hair away from your face, so that we can prevent the sebum deposition and keratin deposition on the face, and avoid touching your face regularly also, because we have microorganism here. We can rub it, and you can squeeze it, and avoid heavy makeup during this season.
Okay, and usually people have that habit of touching their face again and again.
Yeah.
But that is not good.
No.
Okay, so you should not touch your face again and again, and take good care of your skin as well. And doctor, when we are talking about acne, as we have discussed, that due to hormonal changes in your adolescent age, acne occurs. But is it like that acne also occurs in the old age as well? Are there any possibility?
Yeah. Acne occurs only old age after 50s also. That is, we can say it's adult acne, because at that time also there is more secretion of sebaceous gland. Secretion is increased at that age. So that acne mostly found in the chin area or mandible area. We can find more in this area.
Okay, so we were discussing about acne in old age. So is it like that they should take some kind of precautions as well, for preventing the acne?
Yeah, they should at that time if acne occurs, they should also take the treatment. It's not like okay हमारा एज तो निकल गया, पिंपल्स आ रहे हैं, हम कुछ नहीं करेंगे. नहीं, अगर वो नहीं करेंगे तो मे दे लीड टू सेकेंडरी इन्फेक्शन ऑल्सो. तो उस टाइम भी हमें प्रॉपर ट्रीटमेंट लेना है और हमें हेड वॉश करना है और हार्मोनल प्रोफाइल चेक कराना है. या समटाइम्स उस एज में मे वी हैव टेकिंग सम medicines, oral medicines, due to that also the patient may lead to have acne. So we have to check all the medicines also ki maybe these medicines may get acne in face or trunk anywhere, so we have to check all that also.
Okay, so that means you cannot ignore. If you are having acne in the old age as well, you have to take proper treatment because it is important. Doctor, we also have some live viewer questions here who are watching this live. We have Riya Sethi, and she's asking, are there any complementary or alternative therapies that can be effective in managing acne?
एक्ने हाँ, हम लोग एक तो अगर आपको एक्ने है तो मैं फर्स्ट कहूंगी कि आप हमेशा डॉक्टर को कंसल्ट करके ही अपना ट्रीटमेंट स्टार्ट करें. इंटरनेट चेक करके अपना ट्रीटमेंट नहीं करें. अपना फेस रेगुलरली वॉश करें. टोनर आप यूज कर सकते हैं. स्क्रब बहुत हार्श स्क्रबर नहीं यूज करना है. मेकअप क्लीन करना है, पर मेकअप को भी बहुत हार्श रब नहीं करना है. With gently you can wash your face, or with cleaner or toner we can remove your this makeup. और कभी भी स्क्वीज नहीं करना है. और आप अपने और आपको अगर स्ट्रेस आ रहा है टीन एज में तो आप अपने डॉक्टर को, डर्मेटोलॉजिस्ट को, साइकेट्रिस्ट को जरूर कंसल्ट करें. क्योंकि एक्ने से भी पेशेंट कई बार, हम लोगों ने कई बार नहीं बहुत बार पेशेंट को देखा है कि उनका मतलब स्ट्रेस लेवल काफी हाई होता है. तो मैं ऑलवेज कहूंगी कि आप अपने डॉक्टर को कंसल्ट करके, क्योंकि डिफरेंट वो पेशेंट डॉक्टर डिसाइड करेंगे कि इनका अगर है कम है तो हम उनको सिर्फ टॉपिकल मेडिसिन से ही क्योर करें. अगर ज्यादा है तो हम उनको फिर ओरल मेडिसिन दें या कुछ और भी ट्रीटमेंट है जैसे केमिकल पील है, वो सब हम लोग स्टार्ट कर सकते हैं ट्रीटमेंट के लिए, जिससे कि हमारा पिगमेंट एक्ने भी रिड्यूस होगा, पिगमेंटेशन भी कम होगा और स्कारिंग में भी इम्प्रूवमेंट होगा.
Right. So consulting your dermatologist is must. If you are having any issue, don't just go to the internet, find it out that it can, this remedy can reduce the acne, and this remedy can definitely cause your acne to gone forever. It is not like that. Go consult your nearby dermatologist. Doctor, there is another viewer, Sonia Singh, and she's asking, what should I do? My symptoms worsen further.
My symptoms?
What should I do? My symptoms worsen further.
Okay, for that we have means consult your doctor. You should start oral medicine also. It gives you much and more relief than you will if you search on internet. You start home remedy laga liya pack. I said consult your doctor and start oral medicine. It's give you, and it's prevent you from scarring also. If you start it early, it prevent you from scarring, cosmetic disfigurement. Later on, you will think, okay, if I would have done this in my teenage, I should scarring nahi hota. So better to start at this age only.
Right. So starting at a very early age, as soon as you find out that you have acne, you should consult your dermatologist and treat your acne as well. Doctor, when we were talking about treatment, so what are the different treatments do you recommend for acne?
Treatment of acne depends upon the grading of acne, then age of the acne. Patient is pregnancy, like in pregnant patient also developed acne, so whether she is pregnant or not, that is also important. And profession of the patient, whether they are doing heavy makeup or makeup or normal office going, so that also depends on the what type of makeup they should use. Or patient having excessive, so we can start oral medicine also. if a patient have less small, the few in numbers, or that we can, so we can start only with topical medicine. There no need to start. If patient having a hormonal imbalance, then we have to correct the hormonal profile also. Like patient may have if PCOD, or irregular menstrual cycle, or hair excessive hair growth, hirsutism, we can. So in that case, we can correct our hormonal profile also and go through the hormonal profile checkup also.
Right. So the treatment depends on the grade of acne. Which type of grade of acne do a person have? Like as we have already discussed, there are 4 grades of acne. So whatever grade of acne do you have, it will be treated accordingly. Doctor, as you have mentioned about makeup, that sometimes people do a lot of makeup and then acne can occur. So is it like that? That somebody cannot use makeup if somebody have acne prone skin, or what precautions should somebody take if they have acne prone skin and they are using makeup?
No, I not say don't do makeup, but choose your makeup according to your skin type or your lesion type, or consult your doctor. Like if you are using sunscreen, like daily basis you are using your sunscreen, whether you are office going or at home, you can use sunscreen, but in that sunscreen it should be gel base or aqua base, or there may be physical sunscreen. There should not, there are 2 types of sunscreen, physical or chemical sunscreen. So I can advise you only physical sunscreen, and that sunscreen should be, or any makeup product or moisturizer, anything you are, that should be paraben free or fragrance free. That may irritate your skin, or it may leads to more aggravate your acne also.
Okay, so these are the things which somebody have to keep in mind if they are using makeup and also have acne prone skin. Doctor, we have our live viewer questions now. Tina is here and she's asking, should I make any changes to my diet or nutrition to help improve my acne condition?
Yeah, in acne, there are some specific diet we have to take precaution that we should not take a high glycemic index containing diet or food. That it's in chocolates, milk products, dairy products, I can say ice cream. These are the kind of high glycemic index food containing diets, which people nowadays teenagers are more using junk foods. Okay, we should avoid that also.
Okay, so
we have to maintain our body BMI. According to that, also we have to reduce our BMI so we can improve our acne also. Yeah.
Okay, so dairy products, chocolates, and junk food. I think you should definitely avoid if you have acne. Ice cream as well, yes. So you have to, all this food looks tasty. It is tasty, but if you have acne, you have to you have to definitely avoid it. Doctor, here is another.
Yeah.
Here is another viewer of us, and he's asking,
this you can check high glycemic index.
Yes, you can go and check as well that it affect your acne condition. Doctor, here is another viewer, Deepak. I'm asking, is it true that popping pimples help them heal faster?
No. This is a wrong concept. It will lead you more scarring and pigmentation. Then in future you will regret why I did this. So better not to do that.
Yes, and as we have already discussed that popping a pimple is not good, because if you pop it, it will leave you scars and pigmentation. So avoid doing that, because people feel that something is on their face, it's irritating, so they feel that popping up is better than treating it. But as doctor already said, the treating is very important. So you should consult your nearby dermatologist. Doctor, there is another viewer asking, are there any potential side effects or risk associated with acne treatments that I should be aware of?
Sometimes acne medicines, whether it is topical or oral, it gives you more dryness to the skin, like or lip dry or skin dryness, or if we'll go for just like chemical peeling, it give you more peeling of your skin. So we can prevent it by using moisturizer, lip balm, something.
Okay, so these are the you can say the side effect, and you can definitely take proper care of yourself. Doctor, there's a question from Ayushi, and she's asking, why do acne symptoms get worsened when you have your period?
Because of hormonal changes. At that time, people get more secretion of their hormones, and the or this acne also dependent on the hormone. That is, I already said, it is the adolescent age. People have more hormonal changes that and both are interrelated. So I can, that's because of that only.
Okay. And doctor, sometimes, as we already discussed, that people now are more active on, the internet. They find something that, this particular mask or this particular home remedy can cure your acne. So how effective are the home remedies to the acne?
I can say this home remedy, if you'll apply something on your face, like face scrub or mask, so from outer skin, it will remove your deposited keratin plug, it will remove that. But the pimples are getting from inside the skin. It's not an external factor कि यहाँ से आके pimple चिपक गया नहीं. It's because from inside it's coming. So for just using a mask or a scrub, how will remove that? We have to treat it from inside. Then in that case, you have to take medicine which will go inside and it will cure you permanently.
Definitely. So if you are applying home remedy, or if you are using home remedy, that can only be like the upper skin can like you can feel like it is glowing or healthy, but as doctor said that if you are having something, it is coming from inside, so you have to go and consult your dermatologist, tell them your history, that you have eaten this thing, or you have this thing, then only it can be treated properly. And doctor, we have another live viewer question here. His name is Narayana, and he's asking, is sunscreen used mandatory in a day in, day out for man?
Yeah, sunscreen is, yeah, I suggest sunscreen in daytime, and it's not a particular specific for men should not use sunscreen or female should use sunscreen. There is no gap in the scientifically, there is no gap. Okay, everyone should use sunscreen of any age, not a child below 12 years, but after that we can use sunscreen. But sunscreen also depends on the type of the skin, of season variation, seasonal variation, profession. It's all depends on, you have to select according to your profession, according to your age group, according to your environment, seasonal variation, according to that. Everybody should use sunscreen.
Yes, the sunscreen should be used by everybody. And doctor, as how should someone should deal with a sunscreen acne allergy? And can somebody use customized sunscreen for acne and acne prone skin as well?
Yeah, for acne allergy, we can use sunscreen like containing, I already said, the gel base or aqua base sunscreen that is paraben free or fragrance free or physical sunscreen. That is most suitable for this type acne skin.
So if somebody is having acne, these type of sunscreen, like physical sunscreen and as the sunscreen gel-based sunscreen, you should use sunscreen. And sunscreen using is important, right, doctor? It is important that everyone, be it a girl or a boy, everyone should use sunscreen. Okay, so it is very important to use sunscreen, and if you have acne prone skin, then also you can have gel based or physical sunscreen, but do apply sunscreen. Doctor, when we were talking about the treatment, we have talked about why it is caused, and we have discussed that during the period time, due to hormonal changes, acne are worse. So if somebody is have not treated their acne before, and now due to the use of they have seen something on internet and they are applying it, and now their acne is worse. So in such conditions, what are your advice to all the people who are watching this live, that do not treat the acne self medication? Because sometimes people do that. If some friend has suggested that this particular cream, ये मैंने लगाया था तो मेरा पिंपल एक रात में गायब हो गया, and somebody is also like that कि अच्छा ठीक है, I will also try. So is it like good, or we can say self-medication can how much worsen the acne?
सभी इसमें मैं बेसिक एक बात बोलूंगी कि सबको एक तरह का क्रीम है, सबको एक जैसा फूड तो नहीं पसंद है, तो सभी की स्किन अलग है, तो सबके ट्रीटमेंट प्रोटोकॉल भी अलग होंगे। और उसने अप्लाई किया तो मैंने कि मैं भी कर लूं, मेरे को भी हो जाएगा, ऐसा पॉसिबल नहीं है, क्योंकि ये तो डिपेंड करता है। उसने अप्लाई किया, उसको हो सकता है कुछ भी हार्मोनल चेंजेस नहीं हो, या फिर फैमिली हिस्ट्री पॉजिटिव नहीं हो, या एक दो लीजन्स आए हो, अर्ली सिम्टम्स हो, तो उसका इम्प्रूवमेंट हो गया, आपका नहीं हुआ। और आप मे भी आपका जो है वो, और अगर उसके क्रीम यूज करने से आपका हो सकता है वो और भी वर्सन हो जाए, में भी डिटोरिएट कर जाए, आप और ज्यादा प्रॉब्लम में आ जाए, आपको इसमें लीड टू सेकेंडरी इन्फेक्शन ऑल्सो। और गलत क्रीम यूज करने से कई बार हेयर पे एक्ने तो जो आएंगे आएंगे, हेयर भी आ जाएंगे फेस पे, सॉरी।
Right. So उसके इतने सारे side effects हो सकते हैं if you know, if you self medicate. So do not self medicate. That is the most important thing. And doctor, as we have already hit the monsoon, so any daily routine everybody should follow for acne management in monsoon?
For monsoon, I must say कि you should use toner, ओके, बिकॉज इस टाइम में हमारा बैक्टीरिया जो है उसको ज्यादा अच्छा इन्वायरमेंट मिलता है फ्लेयर अप करने के लिए, तो थोड़ा वर्सन हो जाता है, तो आप ऑलरेडी थोड़ा टोनर यूज करें, 2 to 3 टाइम्स आप कर सकते हैं, फेस रेगुलरली क्लीन करें। और टाइट डाइट ज्यादा ऑक्लूसिव ड्रेसिंग, टाइट वेयर ड्रेसिंग नहीं पहने, टर्टल नेक ड्रेसेस वगैरह ना पहने, और मेकअप हैवी मेकअप ना करें, और थोड़ा मेकअप जो है वो जेल बेस में यूज करें। लाइक हेयर भी आप रेगुलरली वॉश करें, और हेयर को थोड़ा फेस से अवे रखें।
Okay, so wash your hair regularly, toner का use करें, and because we are here in the monsoon season, so don't wear tight clothing because it can also cause acne. So please take care of all these things which Dr. Pallavi has said, and please manage your acne accordingly. Doctor, when we are talking about acne management, and we have discussed, you know, that some coffee and, you know, dairy-based products everyone should not take if they don't want that acne occurs continuously on their skin. So any lifestyle modification or eating habit which you suggest somebody should take care while dealing with acne?
Lifestyle modification में मैंने I advise already कि first though you should consult your doctor. And don't do self medication. Don't use much dairy products or junk foods. Now teenagers are more prone to, or they attracts you more, the junk foods, okay, ice cream, anything. Or nowadays people or young students are more prone to makeup also. They are at early age also, they are starting doing makeup. So you should select makeup according to that also. It should not be comedogenic. You should choose makeup according to your skin type, according to its component, ingredients. I say कि नहीं ये सनस्क्रीन है तो उसको वो अप्लाई किया, उसको अच्छा है, तो जरूरी नहीं है कि वो सनस्क्रीन आपको भी सूट कर जाए। और अगर आ रहा है तो आप कंसल्ट करें डॉक्टर से, एंड देन यू शुड स्टार्ट योर ट्रीटमेंट।
Right. So all these lifestyle modification can definitely help you in your acne management. And doctor, when we are talking about lifestyle modification, so do physical activities can also help in acne management, running, jogging, or going, you know, exercising?
फिजिकल एक्टिविटी करने से हमारा बीएमआई रिड्यूस होगा, जो इंसुलिन पे डायरेक्ट इफेक्ट आएगा, और डायरेक्ट ये हार्मोनल हमारा एक्ने पे आएगा। तो हम इसको बिल्कुल, अगर ओवरवेट है, ओबेसिटी है, हाँ, तो हमें करना चाहिए।
Okay, so yeah, if you are, you know, fit, you are fine, and you are doing physical activity, it can definitely help you in managing your acne. And doctor, sometimes people also complain that, you know, in the earlier times, they don't have acne, like during their 20s, and, you know, when they come to 24, 25, their acne is increasing. So what are the reasons of, you know, the increasing acne, and, you know, in the increasing age as well?
Sometimes people, they don't have acne in their teenage, in later age after 24 or 30 they are having. In that age also, I said this is maybe of this is everything depends on the hormones. In that is called adult acne. It's developed more on the chin and mandible part, and the treatment protocol is almost the same for both the teenage or adult, but always you should consult with your doctor only, then only you can advise. And that time also means because of pregnancy or post pregnancy or lactating women, or sometimes you are taking some medicine, because of that you may develop acne at that age, or the cosmetics you are using.
Okay, so there can yes, please continue.
Pollution.
So these can be like the different causes of the increasing acne. At earlier times you might not use makeup, or at earlier times you don't take a lot of stress, but as the increasing age you started taking a lot of stress, and many hormonal changes also can cause of acne. Doctor, any general advice you would like to give to all our viewers watching this live session right now?
First, I said wash your face regularly, and if you are doing makeup, then clean it before going to bed, or with your toner or cleanser, or choose cleanser or toner according to your skin type. I said hydrate your skin also. Use moisturizer. We should not be comedogenic, and to maintain the pH balance, and it repair your skin barrier also. And if you are having and the general acne, so I said consult your doctor. Don't, please, first of all, don't squeeze it. That is the most important part. Okay, because it may lead to secondary infection. Then you will develop more boils and cyst-like lesion, and you have to take oral medicine, and it will give you more cosmetic disfigurement later on or throughout your life. क्योंकि ऐसा नहीं किया होता तो ऐसा नहीं होता.
Right, definitely. So don't pop it up, as doctor said, and don't self-medicate, and wash your face twice or thrice a day. So it was a very lovely session. Before we end this session, doctor, any takeaway message for all our viewers who are watching this live?
For takeaway message for teenagers, I said please stop eating much junk food, do physical work, and don't stress much.
Yes, and as stress can be a major cause of acne, right, doctor?
Yeah.
Yes, so don't stress out, and take proper care of yourself. And as doctor said, do not self-medicate, do not pop your pimples, do not pop your acne, and go consult your dermatologist if you are having any kind of problem. And if you are facing acne, please go and refer to a dermatologist as soon as possible. Thank you so much, Dr. UK Pallavi, for your valuable time.
Thank you.
And it has been a very informative session for our viewers. And it is so great to hear you knowing about acne, its management and treatment. And we really look forward for many such sessions in the coming time as well. Thank you. Thank you so much, Dr. UK Pallavi. And thank you so much to all our viewers in today's session participation. Stay connected to our Facebook page, Beautiful Spotless Skin Team. Good day to all.